It will provide unlimited access in less developed countries to those in need of programs of education and information. This will enable emerging professionals to learn basic skills and to remain current in present areas of expertise. Global Reach and Teach will initially focus on the challenges of the training and certification of healthcare professionals and the distribution of information to patients. This healthcare network, once established, will then be expanded to include other professional groups and help rebuild the country's infrastructure to meet future needs. It will also provide unlimited opportunity for worldwide connectivity. Global Reach and Teach is committed to the use of satellite-based distance learning systems, as this technology enables us to have unlimited outreach and access to all. The content developed specifically for these programs uses advanced multimedia techniques for presentation of subject matter. The satellite transmits broadband worldwide, and broadband carries the internet to the point of distribution in the lesser developed country. Transmission is in real time with no delay. Global Reach and Teach using the satellite is able to bring the information highway to the virtual doorstep of any location in any lesser developed country. All programs are on e-based learning platforms, and this allows the integration of the Global Reach and Teach system with any other operating system worldwide. The Center for National Health Development in Ethiopia is committed to the accelerated expansion of primary health care to meet the underserved needs of the country's rural population. Two key components of this program will be the training of 24,000 health workers during the next 5 years and the education of the at-risk population in such subjects as disease prevention, sanitation, water, and nutrition. 27 vocational training centers have been established countrywide and designated as centers for healthcare education and information. Presently, these centers, which will interface with the local population, do not have basic equipment for courseware delivery or programs in the priority subjects that can be taught to different levels of healthcare providers. These programs must be developed for patients, caregivers, and medical professionals. And a broadcast system must be in place that ensures distribution of these programs to the designated educational centers. This would enable the Center for National Medical Health Development to meet its stated goals. The satellite network will provide multiple pathways of communication between the host country, the rest of the international community, and the designated in-country educational training centers. Two-way voice and video will be featured, including no delay, and real-time transmission that will support multimedia formats for compelling content, as well as the ability to collect important information and data.
Global Reach and Teach will convert and adapt standard text and medical curriculum to a multimedia format that will provide compelling programming. This will enhance the presentation of the educational content of the subject chapters. Here are some examples of areas in a medical curriculum that have been developed in a multimedia format for distance learning programs.
Laboratory methods for diagnosing tuberculosis. The goal of this video is not to discuss the impact of the disease on individual patients, or how the disease is spread, or how it's diagnosed clinically, but rather to briefly demonstrate procedures and instruments used at the Wadsworth Center, New York State Department of Health. Please note the components of a BSL-3 laboratory are restricted entry, such that only the technical staff associated with the laboratory would be allowed entry. Protective clothing is also required, the gown, the gloves, and some sort of a mask or respirator with a HEPA filter. Use of a biological safety cabinet with negative airflow is also required, and an on-site autoclave. The mycobacteria are resistant to the sodium hydroxide, and this treatment kills most of the other organisms present in the sample. Following centrifugation, it is important for the technician opening the centrifuge to have on proper safety equipment, clothing and respirator, just in case there had been any damage or leakage within the centrifuge, so the technician is protected.
Today, you're going to learn about ways to sharply reduce the mortality from acute coronary disease. We will discuss the epidemiology of coronary disease, the pathophysiological changes that accompany the course of the disease, the ways to carry out initial evaluation and assessment of patients, and the initial treatments appropriate for the different types of acute coronary disease. Finally, we'll summarize the course of treatment to be followed with the high and intermediate risk patients. Each year, about 6 million patients arrive at U.S. emergency rooms with symptoms that might indicate that a heart attack is in progress or imminent. About 500,000 of these patients are admitted to U.S. hospitals with acute heart attacks. Getting the patient to the hospital in a timely way and choosing the right treatment quickly are crucial. For those patients who are unable to reach a hospital, mortality remains high at 30 to 40%. By contrast, in-hospital mortality has declined to only 5 to 10%. If the patient has an anterior infarct, this will involve occlusion of the proximal left anterior descending artery and will be indicated on the electrocardiogram by significant Q waves and ST wave inversions in leads 1, V2, V3, and V4. The choice among these first-line drugs and the timing of their initial use is determined by certainty of diagnosis, severity of symptoms, hemodynamic state, and medication history. Let's look at each of them and consider when they should or should not be used. Beta blockers decrease the frequency and duration of myocardial ischemia, decrease the development of refractory angina, and decrease the incidence of mortality due to myocardial infarction. If the patient is in an unstable situation, intravenous forms of beta blockers should be used. Another class of drugs appropriate for use in many cases is nitrates. They decrease the frequency and duration of myocardial ischemia and decrease the development of refractory angina.
Harlan could stand because he's like blocking that camera right there behind him.
Not for the right now, unfortunately. I'm sorry. Yeah, because. He left. These are the wires. Can you see those well?
Yes.
There are the central one, which has 2 rings, records the is basically a pacing lead, and it records the distal bipole that's present on the lead. There are 2 coils that I showed you as it was going in, and this lead is the distal. And all 3 of these plug into the defibrillator. This is the device that has 4 ports up top, and most of it is battery and then capacitors, and a small amount is the brains of the outfit.
In the presentation of basic clinical information and selected medical procedures, original programming and patient-doctor simulations can be used as a teaching technique to maximize student participation.
ምላስሽን እስቲ ሁላችሁ ምላስሽን ሁላ ክፈችው ወደ ታች እንደገና ማሰር ይሄ እንደዚህ መሄድ ያስፈልገዋል። እሺ ከሳምንት በኋላ ትመለሻለሽ ሲያምሽ ይሄንን ፊትሽን አፍሽን